Carcinoid tumor is a slow-growing neuroendocrine tumor that originates in hormone-producing cells that line the digestive tract. They can also occur in the pancreas, lungs, or rarely in the testes or ovaries. But more than 95% of all carcinoid tumors originate in only 3 sites: in the appendix, the ileum, or in the rectum. All carcinoid tumors, wherever they show up, produce extra amounts of hormones. When carcinoid tumors occur in the digestive tract or pancreas, the hormones they produce are released into a blood vessel that flows directly to the liver, where enzymes destroy them and in this way prevent their release into the systemic circulation. But when too many hormones are produced, or if there's a tumor in the liver that keeps the liver from processing and removing the hormones, hormones can flood the system and begin to circulate throughout the body, resulting in the carcinoid syndrome. Serotonin and histamine, the primary hormones produced by carcinoid tumors, act on smooth muscles and cause increased gastrointestinal motility, bronchoconstriction, and vasodilation. This is why the major symptoms of this syndrome include diarrhea, wheezing, and facial flushing. It is important to know that only about 10% of people with a carcinoid tumor will develop carcinoid syndrome. And if there is a tumor that is not causing carcinoid syndrome, the patient may have no symptoms at all, and the tumor may be discovered during a routine examination. Sometimes people develop symptoms due to the growth of the tumor, similar to symptoms of other intestinal tumors. These symptoms are mainly cramping pain and changes in bowel movements as a result of the tumor blocking the intestine. Symptoms of carcinoid syndrome are frequently mistaken for other diseases, such as Crohn's disease or irritable bowel syndrome. Patients may often wait for 5 to 7 years from the initial onset of their symptoms to receive the correct diagnosis. And 60 to 80% of patients are diagnosed with advanced disease and liver metastasis at initial presentation. When symptoms lead a doctor to suspect a carcinoid tumor, the diagnosis can often be confirmed by measuring the amount of one of the chemical byproducts of serotonin in the person's urine, which is collected over a 24-hour period. The next step is to locate the tumor using different imaging tests such as CT, MRI, or a PET scan. Most carcinoid tumors have receptors for the hormone somatostatin. Doctors can inject a radioactive form of somatostatin into the blood and use a special camera to locate a carcinoid tumor and determine whether it has spread. When a carcinoid tumor is restricted to a specific area such as the appendix, rectum, or lungs, surgical removal may cure the disease. If the tumor has spread to the liver, surgery rarely cures the disease but may help relieve symptoms. Other treatments such as embolization can also help relieve some of the symptoms by injecting a substance into an artery in the liver to block the blood flow to the tumor. Radiation therapy is often unsuccessful because of the poor tolerance of normal hepatic tissue to radiation, and no chemotherapeutic regimen has been established so far. Certain symptoms, including flushing, can be relieved by somatostatin analogues, which inhibit the release of most hormones. Carcinoid tumors grow so slowly that even people whose tumors have spread often survive for 10 to 15 years. The 5-year survival rate for people with a carcinoid tumor that has not spread to other parts of the body is 97%. If the tumor has spread to regional lymph nodes, the 5-year survival rate is 95%, and if it has spread to distant areas of the body, the 5-year survival rate is still 67%. Thank you so much for watching this video. If you liked it and you want to see more of my educational videos, please consider subscribing to my channel.